I think the easiest way to understand this is to compare veins in our legs to plants in our garden. Just like our legs have deep veins that live inside our muscles and do bulk of the good work, we have healthy plants that produce flowers and fruit in our garden. Unfortunately, the garden can also become host to some unnecessary plants or weeds that now compete for the same space and nutrients. As these weeds continue to grow, often at the expense of the good plants, you understand that there is a need to help tilt the balance in favor of desirable plants by getting rid of the weeds. In olden days, your options would be limited to manually removing each weed. This was an invasive process that could damage parts of your yard. Even worse, the weeds that you may have left behind now grow rapidly in the space that is now available. After some time, you may feel as if your yard is worse than it was before you started removing the weeds. This is comparable to vein stripping that Kendra's mother had when she was younger. Injection sclerotherapy that Joey's wife had can be compared with our good old weed killer that we use in our yard to help reduce the weeds. It is a less invasive process, but offers a lower chance of long-term success and often requires repeated applications. Modern investigational tools such as ultrasound now allow us to understand the full extent of the problem and identify the target areas better. Using laser technology, we are able to target the problem areas at their source with pinpoint accuracy in a safe and painless manner. Any small residual veins can then be treated using injection sclerotherapy that is far more effective when the larger veins have already been treated. Sometimes there may be an extensive cluster of residual veins with the roots full of trapped blood. This can actually be compared with a pipe that is full of water that we are attempting to seal with superglue. As you can imagine, the superglue will not be very effective since water will likely dilute the superglue. Using a procedure called transcatheter closure, we are able to bypass these challenges. A catheter, which is like a drain pipe, is inserted to remove the trapped blood, and then the same pipe is used to fill the diseased vein with medication, sealing it from the inside. This procedure is safer and more effective than injection sclerotherapy. This allows us to not only target the larger network of diseased veins, but also allows us to cut down the number of visits or injections necessary to achieve the desired results. Treatments nowadays are extremely effective, safe, and virtually painless with no downtime. You can resume normal activities immediately.
This makes so much more sense. So what is the next step, Doctor?
Well, first we will need to perform a detailed ultrasound evaluation of your legs. We will gather relevant medical history and also perform a physical examination. This will allow us to have a better understanding of your venous system and whether treatments will benefit you. I will also introduce you to our staff member in patient account services. As you may know, your scans and treatments are all typically covered by all insurance companies. She can help you get more information about the coverage that your individual insurance provides and assist you with the next steps. I am always available for you if you have any questions.
Doctor, my sister who lives in Canada would like to come here for her care. She is concerned about the costs. Are the treatments expensive?
We believe that excellent care does not have to be expensive. Please feel free to ask us for our transparent pricing booklet. Although most insurances offer coverage for symptomatic vein problems, we also offer private pay options at discounted rates. Many patients from other states and abroad have been pleasantly surprised to find that treatments are very affordable. Our patient account services can assist you. Now there is no reason to wait for healthy, good-looking legs that you have always wanted. We are here to help you.
Doctor, my last question is, How is Alsara Clinic different?
I believe that passion combined with relentless dedication leads to excellence. Above all, if one loves what they do, it not only shows, it makes all the difference. Thank you for your trust in our care, and welcome to Alsara Clinic once again.